All right, we can go ahead and get started. My name is Megan. I'm an occupational therapist at More to Say, which is a pediatric therapy clinic specializing in occupational therapy, feeding therapy, and speech therapy. We are located in Brantford, Oxford, and opening a new location in Shelton as well. And we also offer telehealth therapy services across Connecticut. Today, we'll be covering the topic of tummy time and looking into some occupational therapy strategies to support an overall positive experience for you and your child throughout the tummy time process. We'll go ahead and go through a presentation today, and we'll have some time at the end to go over any questions that you guys may have. So first, looking at what is tummy time. Tummy time includes positioning your child on their stomach while awake and supervised. This may look like what we see above in this photo, a child laying on their belly on a supported surface such as the ground, or it can include placing your child on your lap, your chest, or any other surface in which they're positioned on their belly. Tummy time comes with numerous benefits. Many that stand out include helping support strength and gross motor coordination. However, there is so many other benefits to tummy time that we'll cover today. Looking into strength and gross motor coordination, tummy time overall helps facilitate neck strengthening. It allows a child to learn how to hold their head up, how to rotate their head to various sides, and supports this ability across various positions. This skill is necessary for supported sitting, to assist during crawling, and to maintain their head upright while being held by the caregiver. Tummy time also facilitates shoulder stability and improves the strength and use of our overall upper body. When a child is positioned in tummy time, we're encouraging them to weight bear through their arms, which is often a prerequisite skill for pivoting around on the floor, crawling, and even pulling ourselves to stand. In addition, tummy time provides the opportunity to promote core strengthening. It activates our core, which is necessary for a child to learn how to hold themselves up, sit, supported and unsupported, as well as being necessary for crawling and other developmental milestones. Tummy time encourages early mobility for children, and it is a foundational skill for rolling and transitioning between developmental positions. Beyond just gross motor and strength benefits, tummy time also comes with many benefits for our visual system. Visual tracking, which includes a child's ability to look around and follow an object or a caregiver, often occurs throughout tummy time. Around 3 to 4 months, children really are working on strengthening their visual tracking skills, and placing them in a tummy time position allows them to actively explore, look around at you, toys, or anything nearby in their environment. Additionally, it helps facilitate hand-eye coordination. While in tummy time, we might see a child reaching for objects or reaching for toys, and kind of working on facilitating our overall coordination with our hands and our eyes together. Next, we see tummy time developing depth perception. Because the child is actively exploring a new position, we're going to see them look around for different objects, and helps us understand where we are really in space, and helps our eyes understand how far away things are from us. Tummy time also comes with some more benefits. Looking first at our sensory processing. So looking at how a child interacts with their environment around them, tummy time allows them to build improved body awareness. A child will start to learn where their body is in space, which is necessary for all other forms of mobility. Tummy time also stimulates our vestibular system, which is associated with motion and balance, and can be really helpful for, again, all those later motor milestones that will develop. Additionally, tummy time is necessary for proper head development. With the Back to Sleep campaign, often a lot of kids are spending time on their back sleeping for safety reasons. So it's really crucial that we're spending a lot of time in the tummy time position to help our heads develop into very round shapes and reduce instances of plagiocephaly, which is the flattening of the back or sides of the head. Additionally, tummy time allows children to actively explore their environment and facilitates improved caregiver connection. It promotes them to look around at noise, lights, motion, and your face while engaging with the child. And lastly, tummy time also develops fine motor skills. When When engaging in tummy time, we are working on supporting and developing hand strength through weight bearing through our hands, and it also allows children to learn how to open and close and use various grasp patterns when reaching for toys. These fine motor skills are necessary for support across play, as well as self-feeding in the future as they get a little bit older. I want to spend some time today looking at tummy time norms. We know that across the first year of life, children are going to be spending a lot of time in this position, but it may look very different based on your child's age. Looking first at newborns, between 0 and 1 month, we see a child laying on their tummy, and it's going to often be characterized by their head being fully flat on the ground, either to one side or the other. Close supervision is necessary across all tummy time, but especially important at this age to ensure that the child's airway is clear. You can see in this photo here, the baby's head is turned, allowing him or her to take in the world around them, and also just to have an open mouth to kind of breathe while in that position. Next, we see a child of 1 to 2 months. During this age frame, children will engage in tummy time and they'll start to lift their head off the ground some. You might see them slowly prop up a little bit on their forearms, and they may need some assistance at this time to really help support their elbows underneath their shoulders to allow them to extend our neck. Moving on, for children ages 3 to 4 months, we really start to see them take off in terms of lifting up higher and extending through the neck and arms. You'll see them holding their head higher for longer durations. They're now going to be propped up on bent elbows, as seen in the photo here. And we might even see their hips and legs go more into a frogged position where their knees are out and then their toes are pointing inwards. We might see this because children are shifting their weight more backwards into their lower extremity, which allows them to lift their upper body, head, and neck even higher when engaging in this position. And lastly, taking a look at children of 5 to 6 months, we see children at this age starting to fully extend onto their arms. Their elbows are now going to be much straighter. They're going to have good control of their head and neck while in this position, and they may even begin to pivot around in the tummy time position. The photo with the child on the blue mat, you can see the child is fully extended through their arms, and they're starting to move side to side to actively explore toys or other objects nearby. So a common question that people have is, when should we start tummy time? Tummy time should start right away. As soon as your child is coming home from the hospital, it's important you begin this tummy time to really facilitate all that early motor development and all those other great benefits that we discussed prior. When a child is a newborn, we want to focus really specifically on supervised short bouts of tummy time in these early stages. Specifically for newborns, before even placing them down onto the floor for tummy time, we can focus on tummy time on our own chest or in a football hold carry position as a way to start really early on. We'll talk a little bit more about what that looks like in the upcoming slides. In addition, if your child spends some time maybe in potentially a NICU, you'll see therapists or other personnel working there kind of facilitating tummy time as well as supervised by them. Oftentimes, people are really wondering how much tummy time we should give our children. The amount of tummy time depends on your child's age. Depending on where you're looking, you'll see varying time frames. However, these are some general rules of thumb that we recommend and follow here. First, I always like to say we want to aim for frequency and not duration. The more often you can do tummy time, the better. And even if it's in small bouts, that's okay. We're just working towards a cumulative total of a certain amount of tummy time every day. It's really important to work on that to offset time that the child is spending on their back, either in carriers or other supported positions throughout the day. For a child of 0 to 2 months, we recommend starting with very short 2 to 3 minute sessions of tummy time, aiming towards 15 minutes per day, broken up across 3 to 5 maybe times a day. For a child of 3 to 4 months, we recommend engaging in 3 to 5 minute sessions of tummy time as tolerated, aiming for 20 to 30 minutes per day. Moving up to a child of 5 to 6 months, we are aiming to engage in 5 to 15 minute length sessions of tummy time, aiming for 30 to 60 minutes per day, and building to longer stretches if tolerated. At the 6 month mark and beyond, we're really looking to engage in longer tummy time sessions, maybe 10 to 20 minute sessions multiple times a day, totaling to 60 to 90 minutes per day. Of course, life happens and everyone is really busy, so these are just some rules and guidelines on what we recommend. Any time that your child is spending on your tummy time is great, and we really just want to work on increasing that frequency multiple times a day. Now for some strategies to assist with increasing your child's tolerance to tummy time. I'm going to go through some general tips as well as some ways that we can provide more stability and support for our child to make them feel more comfortable in this position. First off, we want to make tummy time part of our daily routine. If you build tummy time into your routine, it's going to be much more achievable for you and your child. I might recommend building tummy time into your daily routine, such as doing tummy time around every child's diaper change or other daily activities you're doing multiple times a day. Like I mentioned before, really building up the duration. It's okay to start very small, multiple times a day, especially when a child is young and still building that tolerance, and then slowly work up to longer bouts of tummy time. Next, it's crucial that we focus on regulation. We want to read our child's cues and ensure that they're not overtired or hungry when practicing tummy time. If your child is in a regulated state, it's going to be much easier for them to engage and to really work on those skills that tummy time brings. So really just reading their cues and kind of keeping that in mind. If a child is becoming distressed with tummy time, it's okay to take them out and return back to it in a little bit when they're feeling a little bit more comfortable. And lastly, we want to ease into tummy time. Sometimes we might be moving through our day and we're just like, let's get the tummy time done and put our child down. But it can be helpful to kind of first really interact with your child, hold them, capture their attention with toys or with yourself, and then slowly place them into that tummy time position. That way it doesn't feel abrupt and it can kind of focus more on having tummy time be a co-occupation together, allowing us to really just connect and engage with the world around us during this time. Moving on, we really want to make sure that tummy time is also motivating. Some ways we can make tummy time more motivating is by positioning preferred and age-appropriate toys in front of your child. In the next slide, we'll talk a little bit about what are some age-appropriate toys or activities you can be using to increase engagement in tummy time specifically. And also we can make tummy time motivating by building tummy time to be an opportunity where we connect and interact with our child. Our child is so motivated to interact with us, therefore positioning ourselves in front of the child can be really helpful for them wanting to engage in tummy time for longer durations. The next two strategies look a little bit at providing external supports for our child to help make them feel more stable in this position. On the right side here, we see two photos, one of a child using a boppy and the next of a child on a towel roll. These are two strategies or tools that we can kind of use to increase the stability for a child. Using these tools helps the child naturally shift their weight a little bit back into their hips, into their lower body, allowing them to lift up and extend their head and neck some more. These are some great tools to use throughout your time with tummy time, especially early on when a child is still developing that tolerance for it. And lastly, don't be afraid to use yourself to provide physical assistance. We can help a child by tucking and propping their elbows about under their shoulders, and that can provide extra stability. You can even hold your hands near their elbows while in that tummy time position, just to kind of guide them to where they might want to hold their body. You can imagine if our shoulders and our elbows are out really wide, it's going to be really hard for us to extend and lift our head and neck up. So we want to really work on propping them underneath the child's body.